Sim.
Assalamu alaikum everyone and a very good afternoon. I'm Dr. Sara Khalid, working as a senior registrar at Department of Surgery, Liaquat Institute of Medical and Health Sciences, LUMHS Thatta, and I'm here with the topic of my research, that is surgical audit at Civil Hospital Thatta. Before going into the detail of the study, we must have a brief introduction that why this topic was done, why the study was done. So as we all know, it's a well-known fact that Thatta is one of the most historic cities of Sindh, which has a rich history and culture. But because of some administrative malfunctions or something, today, unfortunately, it is one of the most neglected areas of Sindh in terms of health and education. In such a scenario, Liaquat Institute of Medical and Health Sciences, LUMHS, was born as a constituent college of LUMHS in the year 2023, which was then recognized by PMDC in 2024. As a result of this, the DHQ Hospital of Thatta, which is located in Makli, was converted to a tertiary care hospital, providing the services to the underprivileged people of the Thatta. And this gave a way to the research that what type of changes have been brought in terms of surgical department and surgical services. So a study was conducted, and the purpose of this being to conduct an audit of the surgical ward and the services being provided after its upgradation. These are the objectives of my study: to evaluate the demography and diagnosis of the surgical patients at Civil Hospital, to evaluate the surgical procedures that are performed, and to compare and contrast the pre-PMDC approval and after PMDC approval scenario. So as the methodology was done, and it started from the ethical review committee, a letter was taken, and then the cross-sectional study was started. The data was collected from the hospital record after the approval of the head of department and taking consent from the patients. And then from April 2024 to September 2024, the data was evaluated using SPSS 16 software. Only there were the descriptive variables, so the frequency and percentages were taken from the SPSS 16 softwares. This is a slide which is important overview of the results, in which we'll be discussing the number of OPD patients which increased grossly, the operative procedures, the number of operative procedures, and the type of operative procedures that were done, the number of patients admitted per month, and the variety of the surgical cases. So a total of 730 patients have been admitted from April to September 2024, most of them being male, making a 59.5%, and 455 of them out of 730 were surgically intervened. This is important, that more than half of the patients were surgically managed. Any of the major or the minor surgical intervention was done in that. And here is another one of the demographic results, which says that in our ward, the patients were not only from the Thatta city, because Thatta city is also present in Thatta district, and most of the patients covered most of the cities of the Thatta district. The highest number being from Thatta, then from Gulamula, and then from Makli. This is a bar chart that is showing the monthly patient admission rate, which ranged from 101 to 139, highest being in August. Here, the compare and contrast is important, and that this is another chart of 3 months data taken from January to March, which is showing the average rate of admission per month before upgradation was 72.3, which visibly increased to 121.67 after the upgradation. Then another thing which was a part of our objective is to see the surgical diagnosis or the variety of surgical cases. So it is the highlighted text is showing us that not only the elective cases, but the acute abdomen, acute appendicitis and pancreatitis type of things which come in the acute surgical cases, and the emergency surgical cases are not also admitted. And the major cases like gastrointestinal stromal tumors, the GIST, the multinodular goiter, the parotid swellings, colorectal carcinomas and breast carcinomas are also being admitted in a ward. Here again, the contrast is important, that before the upgradation, this table is showing us that before that only the perineal surgeries and the benign breast lump diseases were being dealt. The total number of surgical procedures performed are 459 in our study, and this is a list of the procedures that were being done. Here I would also like to show this pie chart, which is showing a compare and contrast. This is a chart showing our audit study compared to this one, which shows that prior to the PMDC approval, only these type of surgical procedures being performed. Here the important thing is not the variety only, but also the improvement in the technique. Here we can see the people from the surgery know that this is a darning repair, which is a non-mesh repair of inguinal hernia, which was used to be done before the upgradation. After the upgradation, it has been changed to Lichtenstein mesh repair, which is the gold standard technique used for inguinal hernia repair. Since October 2024, advanced surgeries like parotidectomy, sigmoidectomy, and anterior resection, and also the tunneling by procedure for the varicose veins is also being performed. We conclude this audit which is telling us that the number and the variety of the common surgical diseases that have been presented to our hospital in the region of Thatta, the improvement in the rate of admissions, the variety of patients, the procedures, not only the number but the variety, and upgradation from minimal to extensive surgical techniques, which has overall improved the quality of care in the people of Thatta. There are a few limitations of this study, as we saw that we have compared a 6 months data with a 3 months data. The reason being that since it is a new hospital, so there was, prior to the PMDC approval, there was no proper record keeping, so it was very difficult to retrieve the old data, but eventually we have taken an average and compared it with, but this is also giving us way for further study because the research area is empty at that region. So thank you so much. This is the main gate of our campus. Thank you so much.